In Liberia, the Ebola crisis gave the nation a head start in the fight against COVID-19. Ebola-era intensive care units were reopened swiftly across the country after detecting the first COVID-19 case in March 2020. Jerry Brown, named the 2014 Time magazine Person of the Year for his dauntlessness during the Ebola crisis, was called to the front line. Now staring down the barrel of a coronavirus outbreak, he and other doctors put on their armor, gloves, masks, and protective suits and head to battle.
It was a collective effort. Different entities came together and work as a unified force to be able to overcome the Ebola virus. With a concerted effort, I'm sure we can do similar things with Corona.
Drawing from Ebola lessons, the Africa CDC established a community-based surveillance system across the continent that provided real-time information on the spread of the virus. The goal? To promote surveillance-driven public health strategies, including testing and tracing, access to diagnostic and protective equipment, and effective virus control measures. And effective partnerships would be essential in boosting impact.
We sit down and think about what are the issues that needs to be addressed, and we all join hands and address it together and use the funds that are available to do that. That is a new way of doing business that it's not very common for the continent, and we like to promote that with other partners as well.
As part of this drive, the Mastercard Foundation deployed $40 million to Africa CDC to boost COVID-19 testing. These funds bought and distributed about 2 million test kits and backed the training, equipping, and deployment of more than 12,000 community health workers.
The Mastercard Foundation has mastered both the act of giving and the gift itself.
The Partnership to Accelerate COVID-19 Testing, PACT, helped mobilize experts, community workers, supplies, and other resources to test, trace, and treat COVID-19 cases in a timely manner. Quickly, the Africa CDC supported national governments to establish new laboratories at international standards and scaled up testing capacity with expertise and equipment.
They were able now to support us a lot, more so in community-driven initiatives that was to provide, first of all, the information and training for our community CHVs, which are the community members. And then the other part also was a lot of prevention and also testing.
And as countries around the world stockpiled equipment needed to cope with the pandemic, the Africa CDC set up a pooled procurement system to reduce the cost of medical equipment, logistical delays, and maximize the purchasing power of African countries.
We're not asking for donations. You can donate to us if you so wish, but our basis is not a donation. That means we want access to purchase.
This emphasis on collaboration over competition helped African countries focus their energies on responding to the pandemic. From Cairo to Cape Town, the pandemic spurred innovation as countries combined both existing healthcare protocols. But another major scientific breakthrough would also deliver a dose of hope in the fight against COVID-19. A vaccine was now mission possible. Could the continent now summon the strength found in unity to find a sustainable solution? Next, the vaccine is here, and the rise of a new lingo, vaccine apartheid.